I'm Dr. Rushikesh Maheshwari. I am an endocrinologist working at Nanded. I am working as an endocrinologist since last 6 years. So I am going to share few of my experiences since I am using this empagliflozin molecule or SGLT2 as a whole. So empagliflozin, as we all know, it's really wonder drug for our diabetic patients. Since the invention of SGLT2 inhibitors, the management of diabetes has become easy. And that's what we can say because we need more and more drugs which work with different mechanism of action for diabetes, and the efficacy or potency, what we can say, for SGLT2 inhibitors or empagliflozin is quite high. Like whenever we give full dose of empagliflozin, that is 25 milligram, it works very well. And even if we reduce the dose to half, like 10 milligram, it works not 50%, it works 80% of the full dose. So by reducing the dose, still the action remains very potent, and HbA1c reduction is very potent. I want to share experience of one of my patients who was on empagliflozin I started with because her HbA1c was around 8 or 9. She was a female patient having age of around 55 or 56, and she was having some uncontrolled sugars with OHs, and she was not willing to start insulin. Her HbA1c was around 9. So I started that patient on empagliflozin, explained her that she has to keep her genital area clean and maintain the hygiene. So she was doing all the things well. Her HbA1c was around 9 when I started this treatment and asked her to come back after 3 months. She came back after 3 months. Her HbA1c was a little bit reduced from 9 to it has come to 8.4 or 8.3. But she developed some PV white discharge and some bad foul smelling. So it was a candidiasis, and I started her on treatment for genital candidiasis with vaginal tablets of antifungal tablets. And patient sugar was still not controlled. That's what I can say. So after that, I started around combination of empagliflozin with linagliptin and asked her to come back again after 3 months. So the complaint of genital mycotic infection was not there when she came for next follow-up. Patient was having HbA1c reduction further, and HbA1c came around 7.2. So almost our target was achieved. And again, along with that, what I can say is patient was tolerating this tablet very well. This time there was no complaint of itching very vulval region. There was no complaint of white discharge and all. And patient's sugar was also very much controlled. At this time, she also told me that she was not controlling her diet as strictly as she used to control before. Still, her sugar is very much controlled. So the putative mechanism of action of these two drugs, as we know, SGLT2 inhibitors and DPP4 inhibitors, they are having different mechanism of action, and our ominous uptake of diabetes is affected at multiple segments rather than a single level. So the sugar control has become very controlled or very easy for this patient after using this combination. This combination reduce the sugar per se, but also reduce the genital mycotic infections. That's what is my observation in many of the patients, not only this one. Because first and foremost mechanism is control of the glucose. So glucose control causes reduction in the urinary tract infection because the less glucose level in the body, more is the immunity. That is first mechanism of action. Second proposed mechanism of action is that there is some DPP4 activity in some fungi or algae. So these DPP4 are inhibited by this DPP4 inhibitors, and the reduction in the genital mycotic infections happens because of use of DPP4 inhibitors. So the combination of these two molecules is very much favorable for us. One is increasing the risk of genital mycotic infection, other is decreasing the risk of genital mycotic infection. And the action for diabetes is also goes hand in hand, and that's why the benefit is not only control of the glucose but also control of the genital infection, which is the far most and very bad side effect of SGLT2 inhibitors. So the combination of empagliflozin with linagliptin has made me to write this molecule more frequently than I used to write SGLT2 inhibitors with caution or with very much worry in my mind that patient might get UTI or genital infection. So the risk of genital infection definitely gone down with the use of this molecule. So my patient was also happy. Now she's taking this combination since last 1 year, and the sugars are very much controlled. Like what I can say is there is no genital infections after that, and patient sugar is also maintained. So efficacy, durability, and risk of side effects is less when this combination is used, and I'm using it very frequently. Thank you very much.